me and my fellows went to visit a beneficiary of CMF. And I actually had the privilege to hear about this woman's story. Her name is Mrs. Chen. So she was actually pregnant onto week 34, but during the time, it was Chinese Spring Festival. And unfortunately, she developed this condition called the placenta previa. And what that condition is that it causes bleeding in the placenta, which is here. I can't show you, but she'll require a C-section if it's not resolved in time. So she was really worried that qualified and good doctors and nurses would be gone for vacation during that time. So she felt really unsure about the delivery of the baby while also having that condition. That's why she chose to have a C-section, but at 7 weeks premature. So in consequence, of course, because it was premature, they found out that the baby had pneumonia. Meaning that there's a problem with his air sacs and that he would have trouble breathing. So for 27 days, he actually had to be kept in an incubator and with the help of an invasive respirator, which helps him breathe for his lungs. And that would mean tubes going into his tiny, tiny body. And the cost of that mere 27 days was 150,000 RMB. And imagine being a family with only 1,000 RMB per month. That price is really, really high for a family like that. So that's when CMF stepped in with the financial aid of 5,000 RMB. And I know that 5,000 may seem really, really small as compared to that 150,000 RMB. But what she said to me, it was really empowering. She was like, this simple gesture gave us hope and that we feel that there's still kindness and humanity, and that's why we want to keep fighting for a baby's life. I know that really hit me really hard because I can actually see that CMF can make an impact. Yeah. Oh yeah, and now the kid is 5 years old and he's really, really cute and really, really healthy as well. So yeah, that's really, really cool.
Or recall the last time you've been to a hospital. Try to think of how long that took. Was it under 2 hours? Raise your hand if it's under 2 hours. Under 1 hour? Under 30 minutes? Well, tell you what, a trip from rural places to the nearest NICU might take up to 7 hours. That is a long time. That is when every single second matters. That is when one baby dies every 3 minutes. It's hard to imagine, isn't it? Well, here's why. Can you pull the picture, please? This is the urban-rural division. And at Goldman Sachs here, the closest hospital to here is 8 minutes away, which is 1 kilometer. But in rural China, the closest hospital with neonatal healthcare could be as far as 250 kilometers. That's 250 times waiting time. And in Hong Kong, the neonatal mortality rate is only under 2 deaths per 1,000. Compared to rural China, it can get as high as 150 deaths per 1,000. But we have 2 pieces of good news. The first one is that those deaths are easily preventable and actually affordable. The second good news is that you sitting in this room can very be the person who can save one of those lives every 3 minutes. How do you do that? Andrew can show you.
All right, so who are we? So Children's Medical Foundation, CMF for short, aims to sustain high-quality healthcare for the newborn children in Asia, regardless of where they live. The Children's Medical Foundation is the leading NGO that specializes in newborn intensive care in China. And right now, we already reached 30 program partnering hospitals in 12 provinces in the country. We also give an opportunity to the doctors and nurses to be trained in hospitals in Shanghai for 7 days, so that they can go back to the hospital and share their knowledge on newborn babies to others. We build and provide neonatal incubators and mobile emergency response units to hospitals in the rural areas, as well as financial aids to the families who have premature babies in need of support. And now Jenny will introduce about donations.
Next slide, please. And this is how far we've accomplished. Everywhere CMF has stepped in, there's an enormous decrease in neonatal mortality rate. And the most significant one is in Dazhou, Sichuan. Before we stepped in, every 1,000 babies, 26 will die. But out of 1,000 babies, 21 are saved. Now, we are saying that we have all the credits, but indisputably, we have contributed a lot to this improvement. And CMF has a greater impact. Every $1 we donate, the hospital will fund $10 to $20 to the neonatology department, which means your donation will have return. Every 5,000 Hong Kong dollars can buy 6 textbooks to train a doctor or nurse working in a rural hospital in newborn resuscitation and emergency care. Every 2,000 Hong Kong dollars, we can buy a set of newborn resuscitation equipment for a rural healthcare facility. Every 10,000 can save the life of at least one baby whose family cannot afford their medical treatment. Every 48,000 can buy a specialized neonatal monitor for our neonatal care unit. And every 150,000 can equip an ambulance with a portable incubator. Every 800,000 can fund the establishment of a neonatal care unit. Think about how much $1 million can do, and think about how many babies you want to save. Thank you.
Okay, we're gonna have to do feedback